SABC News, independent and impartial.
From an African perspective. Welcome back to Africa Midday. Zambia is now heightening its measures to safeguard its citizens against COVID-19 and has announced new guidelines, and loudest among the measures are that no individual will be allowed into government buildings without being vaccinated, and mandatory vaccination of all government workers to be allowed to go for work. Well, these measures are ever receiving varying concerns from stakeholders, as reported by our Zambia correspondent Arthur Davis Skopo.
With the detection of the new variant of COVID-19, Omicron, in South Africa and some neighboring countries, and the imminence of the fourth wave this December, Zambia is now heightening its measures to safeguard its citizens. As announced Sunday night, 28 November 2021, all entry points such as airports and borders will have both test and vaccination points, and people entering the country will have to quarantine for 10 days at their own cost. Loudest among the measures are that no individual will be allowed into government buildings and other public facilities without being vaccinated. All government workers will only be allowed to go for work with a vaccination certificate, and journalists will not be allowed to gather news at events if not vaccinated. Zambia's Minister of Health, Sylvia Masebo, made these and many more pronouncements that take force Tuesday, 30th November 2021, for 30 days.
It will be a requirement for all persons to provide evidence of vaccination before entry into government buildings. It will be a requirement for civil and public servants to be vaccinated for them to be admitted at work. This shall be done in consultation with the unions. All bars, nightclubs, and discos shall operate only for limited hours, from 18 hours to 20 hours and 4 times a week.
Well, the pronouncement by government of a seemingly mandatory COVID-19 vaccination is now being met with concerns from some Zambians. Some are saying that people should not be forced to do what is against their will.
My views are influenced by many factors, including my spiritual understanding and perspective. So really in Africa, not knowing because of poverty or being poor, we really do things quite haphazardly, and we may post as if we are being scientific, and yet we don't seem to be doing things scientifically or methodically.
While others are of the view that compulsory testing is welcome. Dr. Isaac Sakala of Resident Doctors Association of Zambia says vaccination are a key component to end COVID-19, but citizens' concerns have to be considered, and he urges people to protect themselves against the imminent fourth wave. From a media perspective, Enoch Ngoma, a veteran journalist who is also lead in the Media Liaison Committee, has this to say.
Forcing them against an international acceptable standard which is set by the World Health Organization. We need to vaccinate. There's no question for that. But not forcing, but we need to vaccinate. We need to use ways and methods that will make sure that journalists can vaccinate, the general public can vaccinate. But holding them by the neck to say go and vaccinate, that isn't good for the media.
Jerome Kanyika, a pharmacist, says human rights should not come in, as this is meant to protect human life.
So in that situation, we have no option. The government has a law to protect its citizens, using all whatever means it's supposed to use. The government have seen that its citizens are free to make their decision. Being vaccinated does not mean that you are going to lose your human life. No. So those who are not vaccinated, they should not say it's the issue of the human life. No, that's...
Lusaka lawyer posted saying there are a lot of legal issues and many unanswered questions as to if those government workers that opt not to vaccinate will be fired from work for insisting not to being jabbed. But Health Minister Sylvia Masebo is insisting that it is not mandatory vaccination.
Whether we are going to make vaccination mandatory, the answer is no, except for those in the public service.
If you tell a civil servant not to report for work if they are not vaccinated, it means that you're not giving them an option. So if you tell them don't come to the workplace because of this, if such a civil servant absconds on account that they are not vaccinated, are they amenable to the provisions of the Civil Servants Code of Conduct? So clarity needs to be rendered around these issues.
From a population of about 18 million citizens, Zambia is projecting to have at least 2.4 million citizens be vaccinated by the end of December 2021 from a total of 9.5 million Zambians that are above the age of 18 and eligible for vaccination. Today, only 9% of the eligible population to be vaccinated have been vaccinated. The pronouncement by government has now meant that many people have to flock in large numbers to vaccination centers. But would the vaccine doses be enough? That question is being answered by a permanent secretary in the Ministry of Health.
What we don't have for now as a problem is the stocks of the vaccine. In fact, we have not least 3 million doses of vaccines available. But the problem we have is that people are not coming.
Zambia today has AstraZeneca, Sinopharm, Johnson & Johnson, and Pfizer as its administered doses. Reporting for SABC's Channel Africa in Lusaka, Zambia, I am Arthur Davis, Scopo.
The United Nations World Food Programme says 9.4 million people are in dire need of humanitarian food assistance in the battle-gripped northern Ethiopia, where government troops are fighting rebel forces. Channel Africa's James Shimanyula has more.
As fighting continues in Ethiopia, Thomson Efiri, spokesman for the World Food Programme,